Hello everyone, Dr. Fink here. Today we'll talk about the 3 most common side effects of anabolic steroids. Quick disclaimer, there's not medical advice, this is entertainment only. For those with a medical condition, please consult with your physician. Anabolic steroids can be detrimental to your health, and I don't recommend anybody to take anabolic steroids. So let's look at the most common side effects. First, we have infertility. Anabolic steroids, androgens will eventually shut down your own testosterone production and going hand in hand the sperm production, leading to infertility. So when infertility will happen depends on what compounds somebody is using, on the dosage and on the duration. Once somebody stops taking anabolic steroids, it takes a period of time so that the own body will recover and can produce testosterone and sperm again. But again, it can depend heavily on the genetics of an individual and on the dosage and the duration of the anabolic steroid cycle. If somebody was on steroids for, let's say, 10 years straight in a very high dosage, it is possible that it will be very hard for that individual to ever recover their fertility. On the other hand, if somebody did a 3-month cycle on 250 milligrams of testosterone every 2 weeks, well, if he stops, maybe he'll recover in a couple of months. It always depends on genetics of that individual. So how can someone on anabolic steroids prevent infertility? Maybe, should I say, minimize. Completely preventing is almost impossible because there's genetic variations in individuals, and it depends on how they respond to certain drugs. There is a drug called HCG, human chorionic gonadotropin, which is basically mimicking luteinizing hormone, and this can actually help you from becoming infertile on anabolic steroids. So this HCG is usually injected subcutaneously 2 to 3 times per week in a very low dosage, and that, in addition to the anabolic steroids, it can minimize or can lower the risk of becoming infertile, because it basically counteracts the shutting down process of your body in reaction to anabolic steroids. It tries to stimulate, to trigger your own testosterone and sperm production. So this is basically trying to protect you from the shutting down from the anabolic steroids. It is not 100% sure that it will help you, that you will stay fertile on anabolic steroids, but it lowers the risk. And again, if somebody is on a heavy anabolic steroid cycle, it will probably do nothing. Second most common side effect would be cardiovascular. Why? Anabolic steroids tend to elevate the bad cholesterol, the LDL, and lower the good cholesterol, the HDL, which can cause clots. And also, in addition, with the increase of red blood cells, anabolic steroids will eventually increase red blood cells. Your blood is getting thicker, more viscous, and this can cause cardiovascular complications. So how can somebody on anabolic steroids prevent that? First, avoiding harsh anabolic steroids such as anadrol, boldenone, nandrolone, trenbolone. Those are notorious for increasing the red blood cells and also for lowering your good cholesterol and increasing your bad cholesterol. Then, having a good diet on such a cycle is crucial. Okay, we don't want too much fatty food. We don't want too much salt, which creates water retention, increasing the blood pressure. We don't want too much red meat, which is also increasing the amount of red blood cells and making that blood viscous. So we want to keep the diet more lighter foods, white meats instead of red meats. We want to avoid fried foods. We want to avoid sodium, as much as possible, not completely of course, but we don't want excessive amounts of sodium. And we will also want to keep our body weight increases in monitor. Okay, if somebody is increasing 20 pounds every 2 weeks on anabolic steroids, the body weight increase can also be due to water retention and increasing dangerously blood pressure and the viscosity of the blood. All that in combination is a very bad mix for cardiovascular risks. Okay, so keeping your body weight in control is also crucial. Okay, of course, somebody on anabolic steroids is trying to improve their body weight to put on muscle, but trying to avoid that increasing body weight being fat or water. Then another way to somewhat lower the risk is phlebotomy. So giving blood can help with reducing the viscosity of the blood. Again, a lot of anabolic steroids can increase the amount of red blood cells and making that blood more viscous, leading to cardiovascular complications. And giving blood every couple of months can help you with reducing the viscosity of the blood. So, third most common side effects with anabolic steroids, liver side effects. And here I would say there's an easy fix for that is avoid oral steroids. Okay, injectable steroids which bypass the liver are always healthier for the liver. All right, so those three side effects are very common. Okay, there's other side effects such as acne or hair loss, gynecomastia. Those are other side effects which I didn't touch upon today, which are more aesthetic, but those are some side effects that can really impact your health in the long run, and that everybody taking anabolic steroids should closely monitor and avoid. Okay, and again, infertility can be, the risk of infertility can be lowered by the concomitant usage of HCG during a steroid cycle. Cardiovascular complications can be lowered by avoiding harsh anabolic steroids such as trenbolone, nandrolone, anadrol, etc. Balanced diet, maintaining a good body weight, and giving blood from time to time can prevent cardiovascular complication or lower the risk. And lastly, for the liver, avoiding oral anabolic steroids can lower the risk of liver damage. So again, anabolic steroids can deeply impact your health. I don't recommend anybody to take anabolic steroids. I hope this video was informative, that you learned something. And if you have any questions or concerns, please comment below. Thank you for watching.